Good afternoon, my name is Faith Grusbeck. I'm a doula and childbirth educator with BirthQuest in Muskegon. And one of the things that doulas do is help people by referring them to services in the community. One of our jobs is to get out in the community and find out what resources are available. So today we're here in Norton Shores with Wedgwood Christian Services. So I'm going to ask everybody here to introduce themselves and tell us a little bit about what they do here.
My name is Carrie Schulte, and I am the case manager for our FET program in Muskegon.
Can you describe what that is?
So the FET program, it stands for Family Engagement Team, and we work with moms who have school-aged children who also have substance use disorders. So we have a team of 3. We have a clinician, myself, the case manager, and then also a recovery coach. So we come to the moms. So we go to their home or wherever they are. We try to make it easy for them to access the service.
So it's moms with school-age children that
Yep.
also have a substance abuse disorder.
Yep.
Are there any other eligibility requirements? Do they have to have Medicaid?
Medicaid, yep.
Okay, so
Yep.
it's funded through Medicaid.
Yep.
And then when you say school-age children, are you talking like 4 to 18 or as long as they're in school?
I think as long as they're in school, they think 4 to 6, to 18. Yeah.
Okay. And how do most people find out about, what is it, the family engagement
Team.
team?
Yep.
FET.
Yep. FET.
So how do people get referred to FET?
So we get a lot of people who refer themselves. They hear about us from just word of mouth in the community. People recommend our team to them. We also get referrals from DHHS or from doctor's offices or, really anyone. But primarily I would say we get self-referrals or referrals from DHHS.
Cool, it's great that people are coming to you for services that they know they need.
Yeah.
I think from working with people with substance abuse disorders, I find that the support that they have and the services that they're connected to really make a difference in terms of their success with recovery. So that's good that people are recognizing that and coming to you for services.
Yes, and I would say that our program is unique because we have a team of 3 and we're willing to come to the mom. So we go to them, we try to reduce the barrier of transportation,
Sure.
And then they could have anywhere from 1 to 3 appointments with us a week. So wherever they are in their recovery, we meet them there, and really kind of help support them through it all.
That's great. Cool. Did you want to also introduce yourself and talk about what you do here?
Sure, my name is Jennifer Tornga. I'm the outreach specialist for our SPA program, which stands for Specialty Pregnancy Assistance. So again, it's a home visiting service, largely case management. So we do a lot of work in terms of preparing for the baby. And it's for women who have Medicaid, who are pregnant, and or recently postpartum, and who have had substance use disorders. And so we do, so we are a team of 2, myself and then our case manager. So we kind of share clients in some senses, where, the case manager will do a whole lot with them, and then I kind of fill in as like appointments can sometimes overlap each other, and transportation usually is a barrier to accessing prenatal care, which is one of the big focuses that we try and make sure that our clients are able to get to, because that's so important for both the health of the baby as well as the mother.
So you're helping to provide transportation for the people in your program to get to prenatal visits also?
That's one of the focuses.
Mhm.
Because we found that research has found that for women with substance use disorders, accessing that prenatal care and also being able to manage any mental health issues while they're pregnant, because whether it is going off of whatever medication the medication they were on before they were pregnant, find out that they're pregnant, oh goodness, I want to get off of it, but then they have, there's also stresses that can happen. So really working with them and their doctors and other service providers on how they can manage both their mental health as well as the developing baby. And also, we work on, accessing stable housing, employment if that's something, like if they're postpartum, like how can they get connected with community resources.
I have a question. So if somebody has already given birth and they're not currently pregnant, would they, because you work with people with school-age children, and your program is with people during pregnancy. So if somebody is postpartum, which, and their children aren't yet school age, is there a gap, or would you help them?
So it depends.
Sure.
So if they have school-age children and they're also pregnant, they would, for the case management piece, because we have case manager for SPA and we have case manager for FET, if they're pregnant, they would move with SPA, because then we would be focusing on, a lot of times, pregnancy is one of the big goals, one of the big things that the women are very interested in trying to work on in preparation for that new baby. Now, if they have school-age children, they can also access our FET team in terms of the clinical side. So that would be like substance use counseling through one of our licensed therapists, and they could also access our recovery coach as well through FET. But they wouldn't necessarily have specifically Carrie as their case manager, if that makes sense.
Sure, so it sounds like the services are very individualized
Yes.
for a person's specific circumstances,
Exactly.
and that they would have to make the first step in calling to find out what they're eligible for and what's going to be useful for them.
Yeah, and one of those first meetings that we have with them after they kind of say, yes, this is what I want to try and do, we do what's called a needs assessment, where we would really just, hey, tell me about your life, what is going on right now, you know, where are you at in terms of prenatal care, where are you in terms of transportation and any barriers, housing is a big thing, employment is a big thing, even accessing like food pantries and stable food and nutrition, making sure that they are signed up with any like WIC services that they may be eligible for, or we have Muskegon pregnancy services that also can help, parenting classes, any of those kinds of things that they would be interested as they're preparing for the baby to come.
Great,
So
thanks for explaining that. And now, do you want to talk about what you do here?
Sure. My name is Ashley, and I am a clinician here. I am part of the FET team, so I'm a clinician for the FET team, and I also am doing a little bit of SUD outreach.
Can you say what SUD is?
Yep, substance use disorder.
So outreach.
Yes, so basically the same idea as our FET program, only it doesn't really have the case management aspect to that. So it's working with adolescents and adults in the community, so going into homes, schools. Occasionally they can come into the office if it's more beneficial for them to do that. You know, these clients range anywhere from like minimal substance use to really intense substance use. But essentially it's providing therapy to these clients in the community where they're at.
So also in-home services, but while they're working specifically with women and children, you can serve anybody?
Correct. Yeah,
Mhm.
so if it's, generally, I think if they do fit one of the other programs, the SPA or the FET program, they would generally be in that program first. If at any point they become ineligible for those programs, that's generally when they transition to outreach.
Because that was something that while I was listening to what you were saying, I was thinking about, well, what if somebody was a father and maybe not the custodial parent, or maybe in the family unit, but are there services also for male partners? So that would fall under your program.
SUD outreach.
yeah.
Yep.
Yeah. And that's only on the clinical side.
Mm-hmm.
So the substance use counseling
Mhm.
side of things. Yeah.
And they've just incorporated the recovery coaching into that, so I know that that's also, you know, if that's something that they're looking for, they can utilize the recovery coach as part of the outreach program as well.
So the recovery coach is also for everybody that's eligible, not just
pretty much.
for people with children and women. So all of the programs that you discussed, they're all, you have to have Medicaid to be eligible for all of those programs. What if someone contacted you and they didn't have Medicaid? What would you suggest that they do?
So for SUD outreach, we're working on getting private insurance also. So that is happening. But if they have private insurance, we just try to connect them with different resources in the community as well.
So you guys are aware of everything that a person may be eligible for, so regardless of their insurance coverage, even if they called here looking for help, you could
We
send them
point
out
them in
somewhere
the
in
right
the community.
direction. Yeah.
That's something that I found in the community, that just navigating the services is so difficult. So somebody, if, first of all, certain services are, there's more services for men than women. So for women, there are barriers, and then there's the insurance barrier, and then there's who can help me. I have children, who's gonna watch my kids while I'm going into either inpatient or intensive outpatient treatment. So there's just, I feel like many layers of barriers that make it difficult for people to access services.
Yep,
Yeah.
absolutely. And that's partly where our case management services are really beneficial in our programs, because my whole job is to help these women find services and access services, and like Jen was talking about, food pantries and getting to and navigating a doctor's appointment, because sometimes it's hard to understand what a doctor is saying to you, and to just have another person in the room with you can be really helpful. Or figuring out the bus system, just different things like that can be really daunting if you've never done it before. And to kind of have someone to come alongside you and help you with that can be really, really helpful in someone's recovery.
And I think too, a big part of that is support. I think a lot of our clients, just in general, that population in general, just lacks a lot of support. So I think initially, right off the bat, having 3 people or 2 people come in and support you in so many different ways is huge. So
Can we talk a little bit for people listening? I know SUD or substance use disorder is a clinical term, and I think we all know what that means. But for people who might not know if that's them, if they have a substance use disorder, what exactly defines that?
It's hard kind of to describe. Like it really just depends. There's criteria that they have to meet to qualify or be diagnosed with a substance use disorder, and that involves, the symptoms that they're having, if they're using substances, if they're withdrawing from those substances, if it's affecting certain areas of their life. You have to meet so many of these things to qualify for that. And each one is a little bit different. So really it's important for them to engage so that we can meet with them and go through that and really, identify that for them, because that's sometimes a big deal for some of our clients, is having that diagnosis and understanding what that is. So it's really looking at, one, if you're using substances, what those are and how that's impacting your life, both physically and socially.
I think that's, when people ask me, I say it's not what you're using or how often you use it, but what happens when you do use.
Yeah.
So how is it, if it is impacting a person's life, to me that's a sign that, if it's impacting their relationships, their ability to keep a job, those kinds of things,
Yeah.
then it's probably something that they could use help for.
Yeah.
Something you talked about was that a lot of times people with a substance use disorder don't have good support. And I think that goes back to stigma. And I think during pregnancy, that stigma can be even greater because we place so much blame on people who use during pregnancy. So what do you think can be done to help decrease that stigma, and what kind of things are you doing within the agency to help people cope with that lack of support and that stigma that surrounds substance use in pregnancy?
I would say, one of the things that we try and do, and that's one of the big things that I do as the outreach specialist, is I do try and go to all the different OBGYNs in the area and tell them about our services, ask them what they know about substance use, and especially medicated assisted treatment, which is, methadone. It's like a prescription, but it, to kind of, a lot of people say, replaces another drug essentially, but
It's another type of
it's
stigma.
yes, there's another stigma attached to that one as well. To try and find out, who is educated on those kinds of things, who's comfortable working with someone who has maybe a mental health issue that they have to take, antipsychotics or some other kinds of prescriptions to help them manage, their depression or their anxiety, and how, so in that sense, really educating ourselves in terms of what service providers and, medical personnel know about the thing, and to, be able to tell a client, hey, do you have an OBGYN? No, I don't, because I haven't done any prenatal care because I don't want them to judge me because I'm, currently using. It's like, well, actually there's a couple people, that I can point you toward that you can go and, see if that's a good fit for you. So really trying to educate our clients about what it is, and then also educate some of the service providers a little bit more into our services and how we can really coordinate that care. I think really does help. We found a couple really good OBs in the area, that know about medicated assisted treatment, so that has been really helpful. And really just asking our clients too, like, hey, like, you have an OB, like, how has your experience been? And then, kind of hearing what has been their experience, and like what are some, barriers or pitfalls that they constantly run into, and how to kind of talk through that and process through that. And to encourage them to speak up for themselves instead of, just kind of taking what people say or how they react as negative, but then, needing to ask questions and engage in that conversation a little bit more, because it is about this is their individual lives, and this is their baby, and they should be able to have the choice and to know that the services that they're receiving, are being given from someone who understands where they're at. So that's one of the things that we do.
So kind of like a doula, you're aware of how the different OBs practice in the area, and you're familiar with which providers are going to provide non-judgmental care,
Mm-hmm.
and then you can refer your clients then to those providers